Now I think I'm going to turn it over to Charmaine Fuller Cooper with the AARP to present Protect Voters 50 and older. Thank you again.
Thank you, Jacqueline. This is a hard presentation to follow because it had such meaningful information, both from Jacqueline as well as from Rebecca, so thank you. Good afternoon or good morning, depending on your location. I'm Charmaine Fuller Cooper, a campaign field manager with our national campaigns team at AARP. I'm delighted to spend some time with you today on a topic that, guess what? Everyone is discussing, including whether you watched the debate the other night or not, is a topic of conversation. Next slide, please. AARP's 2020 voter engagement campaign, Protect Voters 50 Plus, is focused on helping you cast your vote safely and making sure you know all your voting options. And that includes even one of the questions that Jacqueline was just asked on how can voters who have disabilities vote. So we want to make sure that everyone understands their voting options. Americans 50 plus deserve to vote safely, and candidates need to address the issues that matter to us. And when we think of residents and long-term care, we also want to make sure that we're not forgetting them as well, because everyone is eligible to vote. AARP has a proud 34-year history of nonpartisan voter engagement, providing voters with information on where the candidates stand on issues important to our members and their families, so they can make their own decisions. Right now, I want to make sure that I remind you before the presentation is over that AARP was able to gain access to both of the presidential candidates. And we have a wonderful new interview of both President Trump as well as Joe Biden, where they're stating clearly where they stand on key issues to the 50 plus. And I invite you after this presentation to visit aarp.org/election2020 to see that latest interview with both of the presidential candidates. Next slide, please. So what's at stake? AARP is working hard to make sure the 50 plus voter is heard. Next slide. So what are some of the key issues? Strengthening Social Security. AARP will never stop fighting to strengthen Social Security and make sure hardworking Americans get the benefits they've earned. Now, with so many Americans struggling to afford health care and other basic needs, we recognize that Social Security is even more important, and AARP will not stand by for any effort to cut benefits or leave Social Security on shaky financial ground. What does this mean for the American Indian and Alaska Native population? In 2017, the median earnings of a working age American Indian and Alaska Native who worked a full-time year-round schedule was $36,000 compared to $48,000 for the general population of all working age people. This $12,000 deficit continues to impact the American Indian and Alaska Native population throughout your lifetime, and it impacts the amount of earnings that you will receive when it's time for retirement. Next slide, please. So I mentioned strengthening Social Security as one of AARP's key priorities for our voter engagement campaign. But we also recognize that financial security and healthcare go hand in hand, which is why protecting and strengthening Medicare is also a key priority. Medicare is more crucial than ever as Americans face that 1-2 punch of the coronavirus's health and economic consequences, providing affordable health care for 62 million Americans age 50 plus, as well as people with disabilities. Hardworking Americans pay into this program their entire working lives, and we count on the benefits that help make healthcare accessible and affordable. And AARP is committed to strengthening Medicare. So again, what's the impact for the American Indian and Alaska Native community? We know that elders are living longer, but long life can mean chronic illness as well as disability. And we also recognize that this community experiences high rates of some chronic illnesses, whether that's diabetes, cancer, heart disease, or all three, in addition to others. And these chronic illnesses can make self-care difficult and even more so as we all age. Next slide. So we've discussed Social Security and also Medicare. But we also know that we've seen a devastating impact on families and nursing homes due to the coronavirus pandemic. We recognize that the coronavirus has claimed the lives of more than 70,000 residents and staff of nursing homes and other long-term care facilities. And we recognize that throughout America, people age 50 plus and others in need of long-term care face a patchwork of public and private services, costly institutional care, and many times rely on unpaid family caregivers, like some of you may be at this current time. So what is AARP doing when it comes to voter engagement? AARP has 53 state offices. That includes all our 50 states, as well as DC, Puerto Rico, and the Virgin Islands. In our Arizona state office, state staff collaborated with the Secretary of State to develop clear recommendations for county election officials to assist voters in long-term care facilities. In our DC state office, when it came to people who were in long-term care facilities, our DC team is currently working to educate those individuals who work on the front lines as essential workers in those long-term care facilities. We recognize that laws vary in each state, so if you have a loved one who's in a long-term care facility or you're serving as a caregiver for someone who desperately wants to vote, we encourage you to visit aarp.org/election2020, and that will be repeated later in the presentation. But AARP on this website has a plethora of information that's specific for each state that we serve as to what your voting laws are in your state, and also if you have additional questions, provides contact information for your state secretary, your Secretary of State, or your State Board of Elections. Next slide, please. So, in addition to Social Security, Medicare, and our work for long-term care, we're also desperately in need of lowering prescription drug prices throughout the United States. We see that skyrocketing prices are putting vital prescription drugs out of reach for many Americans age 50 plus. Many people with pre-existing conditions are having to choose between paying for their life-saving medicines and other important needs. And AARP is fighting for greater accountability and transparency to stop big pharmaceutical companies from price gouging patients and taxpayers. And we recognize that in Indian country as well, that many people are having to make life decisions of splitting their medications, cutting pills, not paying utilities because they have to have their medication this month to survive. And that's not right for any population. Next slide, please. Our last key priority is one of economics. And we're fighting desperately at AARP to secure the economic health of Americans 50 plus. Unemployment during the coronavirus crisis reached the highest levels since the Great Depression. And even this week, we're continuing to see more and more people who are having to file for unemployment. We recognize that older Americans have been disproportionately affected. And Rebecca mentioned earlier her work with CSEP and placing older Americans in jobs. AARP is demanding action from our elected officials to protect the health and financial security of voters 50 plus. We want to know, what are candidates' plans on these key priorities? And we also want to ensure that older workers can recover from the economic downturn caused by the COVID-19 pandemic. Next slide. So AARP wants your help to cast your vote safely. Jacqueline mentioned that isolation and poverty are key issues and barriers for people being able to access their polling locations, or even just to know their options to safely vote, and even in times to have to report obstacles to vote. So at the end of this presentation, I encourage you to share the information that you've heard today with your friends and family members, and even your colleagues, those that you work with closely or even virtually, to make sure that they are aware of their options to vote, how to cast their vote safely, and also too, if they're looking for information on where the presidential candidates stand on key issues mentioned today, to share aarp.org/election2020 with your friends. I also recognize Jacqueline shared an excellent map related to technological isolation throughout the United States, and barriers to people being able to access high-speed internet. And we know that's a real issue for AARP members, for people age 50 plus, but also families under 50 plus. And we want to make sure that you don't limit yourself to just sharing your information via email, but also feel free to get on the phone to have conversations with friends, family members, and colleagues to make sure that they also have their options to vote. Next slide, please. So again, if you're watching this webinar from home, please take out your pencil or type on your keyboard this key website where you can find lots of information from AARP on your voting options, where you can be directed to your voting options for your specific state, and also to look at where the presidential candidates stand on key issues mentioned today. Again, aarp.org/election2020. Next slide, please. I want to thank everyone for your participation today. I look forward to your questions.
Thank you very much, Charmaine. We definitely have time for questions. You can enter them into the Q&A bubble, or you can put them into the chat. Okay, well, thank you so much, Charmaine. We greatly appreciate your time.
Thank you. Thank you, Jennifer.